How do you take a comprehensive patient history for USMLE Step 2? Imagine walking into a room where your goal is to understand exactly what the patient is experiencing and what might be causing it. That's the essence of taking a thorough patient history for the USMLE Step 2 exam. It's not just about asking questions, but about creating a clear picture of the patient's health. First, introduce yourself, confirm their name, and ask for permission to proceed. Building rapport and showing empathy helps the patient feel comfortable sharing details. Always ask if they mind you taking notes, so they know you're paying attention. Start with an open-ended question like, "What brings you in today?" to let the patient describe their main concern in their own words. This avoids jumping to conclusions too early. Next, focus on the main issue by exploring its details using the SOCRATES mnemonic, especially if it involves pain. Ask about the site or location of the symptom, when it started, and whether it was sudden or gradual. Find out the character or nature of the symptom, like whether it's sharp or dull. Ask if the symptom radiates or spreads to other areas. Check for associated symptoms that might be related, such as fever or nausea. Find out if the symptom is constant or comes and goes, and if there are any patterns. Ask what makes it worse or better, and how severe it is on a scale from 1 to 10. After that, do a review of symptoms to see if there are other symptoms across different organs, like chest pain, shortness of breath, or weakness. Then gather the patient's past medical history, including any chronic illnesses, previous hospital stays, surgeries, and past conditions. Ask about current medications, including doses and how often they take them, and check for allergies, especially drug allergies. Social history is also key. Find out if they smoke, drink alcohol, or use drugs. Ask about their occupation, living situation, and sexual history if relevant. Family history helps identify hereditary conditions common in their relatives. Throughout the interview, note both positive findings that support possible diagnoses and negatives that help rule out others. Be concise but thorough, as time during the exam is limited. Use clear medical terms and spell everything correctly to avoid mistakes. After collecting all this information, think about up to 3 possible diagnoses, ranking them from most to least likely based on what you've learned. This structured approach shows your clinical reasoning and communication skills, which are vital for the USMLE Step 2 exam and real-world practice. Remember, a good patient history is the foundation for accurate diagnosis and effective management.